Well, hello. It's really lovely to see the names appearing on the side of the screen, and just welcome to our webinar. So I just want to introduce myself. For those who don't know, I'm Joan Roberts and I'm manager of the School Health Research Network. And scattered about this room, there are three presenters. So this is slightly different to the format we've had so far. And I will introduce people as they speak. I have Kelly to my left, so you can already see her in the screen. Just to say to those of you who haven't joined the webinar before, we have the format is that we'll have presentations, and if you look to the bottom left of your screen, you will see right at the bottom it says send to everyone, but if you actually press that, you can if you want to type a question at any point when people are presenting, you can actually just send either to everyone or to send to presenters. So if you just want me to see it, and I can read out your question. We will, towards the end, when we've had all three presentations, we will actually be opening the microphone up at the top, which is, if you look, it's sort of lit up in sort of red at the moment, and that's muted at the moment. So you can chat away on your side. We won't hear you, but then if you have a microphone, that will be unmuted at the end, and you can ask questions verbally. So that's the format. We're going to have three short presentations, and we're going to look at, I'm sorry, I've already gone wrong, so I'll just go back to the previous slide. We're looking at how we've been using the data from your student survey and school environment questionnaire that you all kindly have filled in. For those of you who've been on the network since 2013, we've got two rounds of that, and for those who joined in 2015, just the one. And just to show how valuable that is, we've actually now got research studies coming through, so we'll be feeding these through to you in webinar form, but we're also going to have some research briefs, and we'll be sending two of the three research briefs the moment the webinar finishes, and those are easy to read resumes of the research. The third one, because we're waiting for publication date, as soon as that happens, then you'll get the last one as well. So what I just want to do before we go is before we get going, is sorry, I don't know whether I'm pressing things they're too sensitive. Just to remind you, so the student survey, you'll, I'm sure, remember just what sorts of things that are happening in your school that your students responded to. And then the school environment questionnaire, which is looking at, you filled it out, just one person from the school, to say what you're doing in terms of your priorities, the curriculum and the policy. And research can make use of both of those, so they're both equally valuable. Just a reminder, 2013 Sharon survey, that was built around the health behaviour school age children survey, and Welsh Government led on this. They're the national representative for the HBSC, but then the research project student data was linked with school environment questionnaires, and that included 67 schools and 7,376 students. Since then, we've had another round, and you'll see the responses are much greater, because if you remember, it was only one class per year group 2013 survey, but in 2015 we wanted your schools to have the most rigorous data, so you could send through as many pupils as you wanted. So 35,000 plus responses, and we had information from both, 83 schools where we had both pupil and school environment data. And so it's nationally representative, and obviously it's a huge data set, so it's incredibly valuable. So just to move on, I'm going to introduce Kelly, who's sitting to my left, and she's going to talk about physical activity and sedentary behaviour in young people in Wales, and this was based on the 2013 data. So thanks ever so much, Kelly, and as I say, if you want to type away any questions, then do, and we can share them either at the end or during your presentation. That's lovely. Okay.
Brilliant. Thank you very much, Joan. Good afternoon, everyone. So as Joan said, I'm Kelly, and I'm going to be presenting just some of our findings back to you, which a team of people here at Decipher have completed earlier in the year. So just today, I wanted to touch on the whole process of why we chose this particular topic, what we actually aim to find out with our research, how do we go about carrying out the research, and I guess more importantly for you listening is what were our main findings and what do these actually mean for your school. So this particular piece of research was concerned with physical activity and sedentary behaviours of young children in your schools. So first of all, as I'm sure many of us are aware, physical activity is linked to many health benefits. And as you can see, it includes the reduced risk of cardiovascular disease, it aids normal growth and development for young people. And again, it's involved in weight maintenance. As you can see, it's a key determinant of energy expenditure. On the reverse of that, we're also concerned with sedentary behaviour. And when we think of sedentary behaviour, we're talking about any sitting or lying down for long periods of time. So I guess for us, it could be being sedentary at our desks. And for children, it could be being sedentary at home on the sofa, playing video games, for example. It's important to note, however, that sedentary behaviour is associated with heightened risks of poor health outcomes. So, for example, increasing your risk of type 2 diabetes, weight gain, and these are regardless of how active an individual is. So if somebody is active for 3 hours in their day and they go home and sit there for 5 hours, actually there are still health risks associated with sitting on the sofa. As you can see in the little bubble marks, it's currently recommended that children are at least 60 minutes active every day of the week. And it's been shown that if children or young people are sedentary for more than 2 hours a day, that's linked with these poor health outcomes. So hence promoting both physical activity whilst reducing sedentary behaviour should be a dual priority for everyone. So what is the importance of the school setting? Well, school-based interventions within this particular area of research are important for a number of reasons. So firstly, children do spend the majority of their youth being based within the school setting. And this is actually a period of time where health behaviours become entrenched. Secondly, schools have a fantastic opportunity to provide health education, for example. Not only are we delivering health messages, we also have physical education. So it's a real opportunity for us to improve health at the population level. So what did we find out, or what do we want to find out with our research? So first of all, we wanted to look at what is the current situation in Wales. How active are children? How sedentary are children? And when I'm talking about children, we are looking at children from age 13 right up to the sixth form in schools. And secondly, we wanted to find out what factors are associated with young people's activity levels. So perhaps what is it about the school environment that can affect how active or how sedentary children are? So in order to do this, as Joe mentioned earlier, we took 2 data sets. So first of all, we have all the responses from children in the 2013 survey, and we joined these up with the school environment questionnaires which you've completed. In terms of the particular data we looked at in the surveys, so from the children, we looked at self-reported levels of physical activity. So we were looking how many of the young people took part in physical activity 60 minutes a day for 5 days a week. In terms of MVPA, so that's moderate to vigorous physical activity, which is when a children says, I was out of breath or I was getting sweaty. We looked at how many of the children reported 4+ hours a week. In terms of sedentary time, that's a combination of questions. So children were asked, how often do you watch television, or how many hours a day do you watch television? How many hours a day do you play video games, for example? And how many hours a day do you spend on the phone or kind of iPad devices? And we were also asking children, do you actively walk or travel or cycle to school? In terms of the school environment questionnaire, we specifically looked at the length of the school's lunch break. We looked at the length of the PE lessons available. We had a look to see whether a food and fitness policy was reported back in the school environment questionnaire. And we also looked at the provision of sports facilities. So this is where we just added up all the different facilities that a school provides children. And this particular piece of research was performed with 67 schools, and as you can see, just under 7,380 children. So what did we find? So I've split the findings up into two areas for us. So first of all, we'll look at the physical activity findings. So in terms of how many children are actually active 5 days a week for 60 minutes, as you can see, there are 40% of children are physically active. And you may be thinking, oh, but the recommendations are 7 days a week. Mm-hmm. However, not many of the children in our study actually achieved more than 5 days. So this is only based on 5 days a week. And again, as you can see, only 28% of the children were moderate to vigorously physically active for 4 or more hours per week. So this is an increase on earlier data which is shown, but as you can see, it's far below the recommended numbers which we would hope to see. So next we had a look at, who are more the physically active young people? As you can see, so boys had higher levels of overall physical activity. Children who were younger also had higher levels. And those children who had a higher family affluence score were also higher physically active. In terms of moderate to vigorous physical activity, again, boys had higher levels. Children who were older or children who were more affluent had higher levels, and those reporting a white ethnicity were also shown to have increased levels. An important note as well, when we looked at active travel, so 30% of the overall sample said that they actively travelled to school. And when we looked at this in terms of, do they actually travel to school, yes or no, and how active are they overall? For girls, actively travelling to school meant that they were active for higher levels throughout the day, whereas for boys, it didn't make a difference to overall levels. Interesting. Yes. Mm-hmm. And then if we look at what school level factors were associated with our activity levels, in terms of total physical activity, we didn't find any association, so no school factors were shown to be associated with physical activity. However, in terms of the moderate to vigorous physical activity levels, children who were to school with a lower free school meal eligibility did have higher levels. So that's the findings for our physical activity. And then, so moving on now to our sedentary findings. Okay, so first of all, looking at the proportions of children reporting more than 2 hours a day in a screen-based activity. So remembering this is TV watching, also combined with video games, for example, and also combined with phone use. 85% of the sample actually spend more than 2 hours a day. And this is actually sedentary time in their free time. So we're not sure if children are involved in their school time here, but actually when they go home, it's possible that 85% of them are sedentary for more than 2 hours a day. And even worse, as you can see, is the point below, is that the average duration is 7.5 hours a day in total for those three behaviours. So again, this is evidently an issue we have amongst young people in our schools. When we look at who are the individuals who are more sedentary, we are seeing that boys, so regardless of the fact that boys showed higher overall activity levels, higher levels of intense activity, actually boys were actually more sedentary, so they had longer times. and also older students.
Mm-hmm.
Here, as you can see on the slide, there are actually a number of factors at the school level that were associated with sedentary time. So if schools reported a higher level of free school meal entitlement, it was more likely that the children would be sedentary, or higher levels of sedentary behaviour. We also saw higher levels of sedentary behaviour amongst schools where there was a shorter lunch break. We found that if there was a greater provision of sport facilities and if there was longer time in PE lessons, boys in particular showed that they had higher levels of sedentary behaviour. So here perhaps we're seeing that we could speculate on our findings that the more active the boys are in school, so all their total activity, but then actually they're going home and in their free time they are being more sedentary.
That's interesting.
And it's important to remember, Heather, that we are reliant upon self-reported data here. So it would be more accurate if we could have activity monitors, but we need to take the findings with that in mind. So what do the findings mean for your school? So as we've shown, a significantly large proportion of young people are not only inactive, but they're also sedentary. Mm-hmm. So these are particular areas which we should be trying to target together. So how can we do this? Our findings perhaps show that we should be looking at gender-specific approaches. So perhaps we should be looking at promoting active travel for girls in particular, for instance. If boys are being active in the day, then what can we do in terms of trying to educate them perhaps on their sedentary behaviours, perhaps when they're going home? And lastly, there is a need to make families aware of their role. What role can they play in influencing children's activity and sedentary behaviours? So as I mentioned, young people may compensate for this increased activity level in school when they're going home out of hours. So again, it's trying to tie in this role with the school and the family environment.
Well, that's really, it's really interesting, and there are some really core issues, aren't there, for particular schools, and also in how we sort the day. And maybe when we open up the questions right at the end, if anybody has any comments on the sort of sharing with parents, because I know some schools are starting to do that with their data, so that might be quite an interesting concept to talk about. But thank you, Kelly. This is a whistle-stop tour of 3 bits of research, but obviously you'll get the research brief, and there's all, at any point you can get in touch with us in the future with any questions. So perhaps at that point we can hand over to Britt, who is the other side, and she will suddenly appear very shortly, or she did when we practiced. There she is. There's Britt. We're going to hand over for Britt to present, and you'll catch up with me again shortly.
Hello, everybody. My name is Britt Hollingberg. I'm a research associate here at Decipher. I've been a research associate here for 2 years since I finished my PhD. Sorry, we're just having a technical issue with the sound. We're just going to sort this out.
Yeah, that should be fine.
Just a little bit of an echo, so it's a little distracting. There we go. Great. Thank you, Mike. So, like I said, I'm a research associate here at Decipher. I finished my PhD 2 years ago, and I have research interests in young people's health behaviors, specifically substance use and delinquency. And today I'm going to present findings from a paper I recently published with colleagues here using the data from SHARN, and it's looking at school smoking policies and their association with student smoking, cannabis use, and e-cigarette use. So, as many of you are probably aware, schools play a really important role in shaping young people's health. One of the ways that schools can do this is through implementing school policies. So school policies help demonstrate a school's ethos by showing acceptable and unacceptable ways for staff and students and others that are in the school, the ways that they should behave. And a good example of this is a school's smoking policy, which I'll talk about a little bit more in detail in a second. But so if you think about 20 years ago, smoking wasn't as, what we'd like to say, denormalized as it is today. In that it's something that was generally more acceptable to do back then. Many of you will remember possibly that smoking in public wasn't as regulated, so you could smoke in pubs or clubs, and in places where children were often present, like playgrounds and public areas. A previous study using data from Welsh schools collected in 1998 found that there was a strong link. Sorry, I'll go back one slide. So that found that there was a strong link between schools that had a strong smoking policy, and this was a policy that applied to everyone in the school, wherever they were, or wherever they happened to be in the school, and lower levels of smoking amongst their students. So today smoking is more denormalized. It's not generally acceptable to smoke anywhere, and well, just anywhere, and smoking isn't really seen as the norm anymore. So we wondered whether school policies would be important for students smoking still, especially given that smoking rates among students have reportedly dropped in recent years. Also, smoking tobacco is often seen as a gateway into smoking cannabis, and there are also there's an increasing number of students experimenting with e-cigarettes. So both cannabis use and e-cigarettes are possibly not seen as denormalized as tobacco use. So we were also interested in understanding whether smoking policies had like a knock-on effect on other substance uses, such as cannabis use and e-cigarette use. So what we did, we used data from the 2013-14 survey and the accompanying school environment questionnaire. And we looked at students in year 7 to 11 and their responses to questions on their responses to questions on cigarette use and e-cigarette use, as well as cannabis use. From the school environment questionnaire, we were also interested in information about school smoking policy. And we classified school smoking policies in 3 ways. We determined whether a school or not had a weak policy, which was that there was no written policy in place, a moderate policy, which was a written policy in place, but it did not apply to everyone in all locations in the school. And we looked at whether the policy was strong, which was a written policy that was in place and it applied to everyone in all locations throughout the school. Schools also stated which year groups that had received tobacco, drug, and alcohol education and whether they offered tobacco cessation initiatives. We investigated whether the strength of a school smoking policy was related to students' use of tobacco, e-cigarettes, and cannabis. And in total of 7,376 students from 67 schools took part in this. So, key findings. The graph on your left with the 3 red bars shows how many schools reported having a weak, moderate, or strong smoking policy. And as you can see, about 39% of schools had a strong smoking policy, but 44% had a moderate policy, and 17% had a weak policy. Now, the graph on your right shows the change in the percentage of schools with strong smoking policies in the past 20 years. So the bar in blue actually comes from the study that I mentioned earlier on that was conducted in 1998. And that found that 16.4% of schools had a strong policy. And the bar in the red here on the graph on the right shows that in the current study, this had increased to a much higher rate at 39.4%. So as you can see, there's more schools in Wales at the moment with strong smoking policies. This slide shows the results of student substance use. So the graph on the left shows the percentage of young people that currently smoked or had ever used an e-cig. Well, sorry, let me start that again. The students that had currently smoked, the students that had ever used an e-cigarette, and the percentage of students that used cannabis in the past month. And as you can see, a higher percentage of students were reporting e-cigarette use than having smoked cannabis and smoking tobacco. The graph on the right shows the percentage of 15-year-olds who reported cigarette use, again in 1998, compared to the current study. So the blue bar there shows I think it was about 20% of 15-year-olds reportedly smoked daily back in 1998-99, whereas today it's down to 5%. So it's quite a dramatic decrease in 20 years. On to some other findings. We did some fancy statistics that I'm not going to go into detail about, but just to note, in summary, we found that there was no association between the strength of a school's smoking policy and the proportion of students who currently smoked or had an e-cigarette. Students in all year groups were less likely to have used cannabis in the past month if their school had a moderate strength policy in place. And cannabis use was also less prevalent in year 11 students where schools had a moderate or strong smoking policy. Additionally, more provision of tobacco, alcohol, and drug use education was associated actually with an increase in the likelihood of cannabis use. And this is something that I'm going to talk about in a bit detail because that sounds a bit conflicting. So, an issue to bear in mind, students reported their own substance use, but we're not sure if their answers were accurate, if they were in fact true representation of the substance use or not. Schools' enforcement of smoking policies was not measured. So it's been shown in some other studies that how a school responds to a student breaking the school policy, so if they were caught smoking on school premises, how the schools react to that, that's also very important for understanding then how in the relationship with young people's substance use. The relationship between cannabis use and more comprehensive substance use education might reflect what we like to call a reverse causality, whereby schools that recognize a problem with student cannabis use are increasing their education in response to this. So in summary, society is increasingly seeing not smoking as the norm, particularly in spaces where children are present. In contrast to the past when smoking rates were higher, it might make therefore little difference now if schools ban smoking through their smoking policies on or near school grounds, because the smoking prevalence rate is so low to begin with, so it might not have much of an effect. Saying that, schools should probably continue to implement strong smoking policies because of their potential effects on other substances such as cannabis. And that is, I think, me. Yeah, thanks. I'll turn off my camera now.
Hello, I'm back. I think I have a microphone. Yes. Thank you, Britt. That's really interesting. I mean, it brings out a number of sort of thoughts, which perhaps we'll just catch up briefly on after everybody's spoken. But came to mind that just shows those changing health issues and the value of having data every 2 years to sort of track these things. So the next presentation by Ellen, who's magically appeared by my side, moves on very well from what Britt's been telling us about. So I'll hand over to you, Ellen, and maybe we'll sort of catch up on a few questions after.
Great, thank you, Joan. So my name's Ellen DeLacy. I'm a PhD student here in Decipher, and I'm going to present to you today a new bit of research around electronic cigarettes. So we looked at use among young people using the latest data from the School Health Research Network survey. We looked at links to other substances such as cannabis, tobacco, methadone and laughing gas. And then we also looked at the sequencing of e-cigarettes and tobacco. So we looked at which one, whether e-cigarettes or tobacco, which one young people started, and then what did they go on to use, whether they went on to use e-cigarettes and tobacco. So I'm going to share a bit more of that information with you today. So just to start, I'm going to go over a little bit around what we already know, because e-cigarettes still are very much an emerging public health issue. So I thought it would be useful to give some bit more background information before I went into what we found out. So first of all, we know electronic cigarettes, as we call them, they're very much handheld devices, delivering nicotine, generally water-based vapor. They've been in the UK since around 2007, so they're still very, very new, and research is catching up really with what young people and adults are doing around e-cigarettes.
Public Health England commissioned a report last year which said that e-cigarettes were 95% safer than tobacco. This is quite a controversial figure in the way it came about, but perhaps give you an idea of what people think e-cigarettes are in relation to tobacco. We know at an adult level that e-cigarettes have some impact on smoking cessation. So in England, in University College London, they run a survey which runs every 2 months, and they interview and they ask adult smokers around what they're doing in terms of giving up smoking. And we know that there is some impact on e-cigarettes for adults in smoking cessation. However, we are concerned around what e-cigarettes mean for young people, whether they're a new route into nicotine addiction or what is actually happening. However, what we do know so far is that young people are experimenting with electronic cigarettes, and then they are starting to regularly use e-cigarettes. So I think we need to look further into that and see what's happening. So this is quite a busy table, but I wanted to show you this because it just gives you an idea around some other surveys at a UK level to show you what's going on and what we found 2 years ago with some of the work that Britt presented. So surveys have mainly asked young people if they have ever used electronic cigarettes, so if they just used it once. So as you can see, that's around 12% for all the UK surveys over the last couple of years. If we then look to more regular use, so some of the surveys didn't ask this, but of those surveys that looked at more regular use, they tended to focus on monthly use as opposed to kind of either weekly or daily. And as you can see, it's still quite low. And this was, over the last couple of years. So we can see kind of about 1%, 1 to 2% regular use amongst young people. So it still remains quite low. Just onto the product, it's still fairly new. And as you can see, there's been quite an evolution of the product over the last few years. So I did type in the evolution of e-cigarettes into Google. You can see the picture with the monkey and the e-cigarettes below, so you can see how it's very much changed from a product that looked very much like a cigarette to something that I would say looks very much not like a cigarette anymore. So it's quite chunky. You can see the different types of designs you can get. There's lots of different flavorings. We now have the tobacco industry who are part of the electronic cigarette market, and there's been certain types of advertising which you could certainly say have been more promoted towards glamorizing electronic cigarettes and perhaps promoted towards young people. Recently, we've had some regulation around electronic cigarettes. So there's now a ban on sales to under 18. And recently, so just this May, we've had the EU Tobacco Products Directive come into force. So there's now bans on cross-border advertising for TV, radio and print media around e-cigarettes. And by May 2017, all products containing nicotine or e-cigarette products should have prominent health warnings covering 30% of the products, and there'll be regulation of high-strength nicotine products. So they won't be available to buy from shops. You'll have to go to your GP to be able to access them. So part of our study, we also looked at what young people tried first. So did they try e-cigarettes or tobacco, and then what did that lead them to use? So in terms of past research, so there's not been that much around this, but past research has showed that never smokers who use e-cigarettes are more likely to intend to smoke cigarettes in the future. So that's been kind of from small studies. And then so we've had a small number of kind of longer term studies that have followed up young people over, say, a year or 2 years. And then just kind of show you that one study from the US followed about 16 young people, and after 1 year, so of those young people who had tried e-cigarettes, 5 of those young people had gone on to try a cigarette. So we still don't really know what young people are doing if they're moving from e-cigarettes to tobacco or tobacco to e-cigarettes. However, this study, which was very small, did appear alongside a media editorial that said that it was basically a definitive evidence of gateway effect. So it's really unknown at the moment, but some of the studies that have come out have kind of, talked about a gateway effect without there being any sufficient evidence. So it's something we wanted to explore a bit more. So just on to quickly what we did. So we wanted to look at use and frequency of use of e-cigarettes among young people, included smokers, ex-smokers, and those young people who had never smoked. We wanted to look at associations of e-cigarette use alongside things such as tobacco, cannabis, alcohol, methadone, and laughing gas, and then to look at this sequencing of use, so to examine pathways into regular use amongst young people by looking at what was tried first, so either tobacco or e-cigarettes. So on to what we found. So we found that there was an increase in experimentation. So young people were more likely to experiment with e-cigarettes than with tobacco. So you can see it's almost a doubling of use of e-cigarettes compared to tobacco. So we compared this data with the data that we got back from 2013, and we found that regular use had almost doubled and was really linked to use of other substances, especially tobacco. So we found that those young people who were regularly using electronic cigarettes were more likely to be smokers as well. They were also, e-cigarette users were more likely to be male. And in terms of what we found in terms of pathways to use, we found that those young people who report ever having used tobacco and e-cigarettes, they were more likely to report having tried tobacco first. So it seems to be really that most people were using tobacco and then going on to use e-cigarettes as opposed to the other ways. So this thing around a gateway was more likely that tobacco use was leading to e-cigarette use as opposed to the other way around. And tobacco use rates have not risen in line with growing e-cigarette use. So we still see tobacco use rates declining, even though e-cigarette use is going up. So just a couple of graphs just to finish off with. So I just wanted to show you quickly, just to look at use of e-cigarettes and tobacco. So what we've done is we've done this by year group. So we've got year 7 to year 11 here. And you can see we've got weekly e-cigarette use, weekly smoking, every use of e-cigarettes, and ever smoking. So the top line is ever use of e-cigarettes, which as the data shows is much higher. Then we have ever use of cigarettes, and then in terms of weekly e-cigarette use and weekly smoking, so they pretty much are the same until about year 10, where you can see weekly smoking then is slightly higher than weekly e-cigarette use. Then the last graph, which I think is really important, is something that we need to keep an eye on, is around use by never smokers and non-smokers, and this is looking at weekly e-cigarette use. So as you can see, use among non-smokers increases with age, and in use among never smokers increasing as well. And this is just a group of young people we need to keep an eye on, because they're the young people that either don't smoke or have never smoked. So I think that'll be interesting to see over time whether that use rises. So I don't know, one of the things we wanted to cover is what does it mean for my school? obviously this is still an emerging area. So I'm just going to really talk to you the conclusions of the paper, because we still need further research and we need to talk to young people around what this means. So what we found was experimentation with e-cigarettes is almost twice as common as experimentation with tobacco. So young people experimenting more with e-cigarettes than with tobacco. Regular use of e-cigarettes has almost doubled since 2013, so it's certainly becoming more popular amongst young people, although it is linked to those young people already smoking. What we said is that, you know, if it's left unchecked, so especially use amongst kind of never smokers and non-smokers, it could be a public health problem in itself, although we found no evidence of a new pathway into smoking. And that really we need more research, particularly longer term research and qualitative, so where we go and speak to young people about what they're using, why they're using, whether they're using kind of e-cigarettes with nicotine or without nicotine, to understand that use in more depth.
Fantastic. Well, thank you. Thank you. So there's been some really interesting findings amongst the three presenters, and I'm aware that we don't have a lot of time, but it would be nice to unmute the microphone if anybody does want to ask a question. You know, they can do that, but you can also type if you don't quite feel up to chatting. You can certainly type. So
all attendees are muted and may unmute themselves by pressing *6.
I mean, just a couple of points. We now see everybody, so yeah. Point to me, I just think it's just so clear. This change has been shown very clearly from our presentations, and also maybe schools having to look differently. You know, some schools, you know, the value of the data is actually being able to look at what the situation is in your school. So, you know, it was very interesting, wasn't it? The increase, Ellen, the increase in e-survey, in e-cigarette use compared to cigarette use. It was very clear from your graphs.
Yeah.
And I mean, I guess in some schools, you know, would that be different? I mean, it'd be interesting for people to go back and look at their data, won't it, to see what.
I think.
Yeah, what that's.
Obviously, because there's such a big link with tobacco use and other substances, is if schools have slightly higher levels of tobacco use, then they are more likely to have e-cigarette users. But obviously that maybe doesn't account for some of the experimental users. So maybe young people just using it once, because that's so much higher than it's almost double than tobacco. So yeah, I think it would be good for schools to understand their young people, to see what they're doing.
And we've had a question here for Kelly. So why, Kelly, do you think that there's a relationship between school level free meal entitlement and then that level of exercise, and particularly if it's not a moderate exercise?
Yeah, that's a very good question. So one mechanism could speculate is happening here. So we found that the schools with the lower level of free school meal entitlement had the higher levels of activity. So perhaps that's showing that maybe if schools have more, perhaps these are more affluent schools, and these children have a higher number of opportunities to be active throughout the school day and in their community. So perhaps it's not only that they've got more opportunity to be active in the school, but also they can afford perhaps more money to be active in the community areas.
Thank you. That's very interesting. And just maybe to Britt, you know, just the sort of work you looked at, and that sort of link of smoking policy. So I think you're concluding that it's still important for schools to have a strong strong smoking policy, and certainly in healthy schools, if you're going towards the national policy board, you're asked to do that, and it would include e-cigarette use as well. And you know, I think, you know, the sort of 40% that was strong, wasn't it? So you know, maybe that's the sort of route to the future that the healthy schools could look at. I'm aware that the time is running out, and we all share in the same office. So if you've got any questions that you'd like, to ask of any of the presenters, then email me and I can do that. What I'd just like to just sort of complete the webinar with is just, oh sorry. Just as proficient as everybody else at this. Sorry, yeah, those are the acknowledgements from Ellen. So, and that's her email. But as I say, we can give that to you. Just to remind you that there are research briefs coming. I mean, it was clear from what Ellen was saying, it's all still very new and emerging. And as soon as her paper is published, we will send that on to you. Just to remind you, there is one research brief that we've already sent through in newsletters, which was on school commitment to health and implementation of health improvement activities. So look for that on the website. And I'm running out of time, so the one bit of network news I would just like to share with you: we will be having more webinars, but you may recall, and we will just email it to those of you who've joined us. Gillian and I have sent out a questionnaire just to find out what you're doing with your data, the student health and health reports that you get. I think that will just inform and help us a lot. So we have emailed, we will email you again, and it would be really valuable to us if you could send that. But probably the next time we hopefully meet is in the spring term for webinars, and then the summer events that will be happening in June. So thank you so much for joining us. We're pretty good for time, just a minute or two over, but thank you, and we very much appreciate you joining us. Thank you.